Well, the third wave has well and truly taken hold of the country, with the highest daily new infections since January being reported. Gauteng's new cases rising sharply. Hospitals are under extreme pressure already. The Gauteng province this evening, of course, announcing that it's temporarily suspending hospital visiting hours during the third wave. And I'm joined now by Thabo Masebe, Gauteng government spokesperson. Mr. Masebe, good evening. The latest figures coming out from the NICD, yet again a very grim picture. Almost 12,000 nationally, 7,500 in Gauteng alone. Where are your government's major focus areas of concern this evening?
Obviously, good evening, Sally. The major areas of concern remain the high numbers. What we've been doing since the start of the second wave was to target the hotspot areas and ensure that there's more testing in those areas so that people who may have come into contact with those who tested positive are able to isolate, and those that test positive, obviously, if they become ill, they are able to seek help in our hospitals or clinics. So that has really been the focus to try and manage the third wave as we are in the third wave.
Talk to me about hospitalization. Can you give me the latest figures of how many people in Gauteng are in hospital because of COVID-19? I'm talking across public and private.
Well, it's just over 2,500. The number fluctuates because people get admitted to hospital, and those that are admitted, especially those in the public hospitals, include what we refer to as patients under investigation. So these are people who would go to hospital because they feel very ill and they require a COVID test because they present with the COVID-19 symptoms. And while they are awaiting the test results, they are allocated or they are accommodated in beds that are normally reserved for COVID-19 patients. Mm-hmm. So when we look at that, there's about 60% or more than 60%, between 60 and 70% of capacity is already occupied by people who are both confirmed COVID-19 cases and those that are referred to as patients under investigation.
All right, so let me just double check. You're saying that across private and public hospitals, the figures that you have across Gauteng, 2,500?
Yes, just over that. It fluctuates, as I said.
Sure.
As and when people are confirmed, when the results come, if the results are negative, obviously the people are then released to other wards. But if the results are positive, they are kept in the COVID-19 wards. So it would be between 2,500. Yes.
All right. Talk to us about, you say capacity, we're currently at about 60 to 70 capacity. Clearly we're going to need new beds. If you look at how quickly the numbers are rising and the fact that we've got probably another 2 to 3 weeks of this at least, we're going to need more beds. Where have you set up more beds? I think Chris Hani Baragwanath is a key area, am I right?
Yes, Chris Hani Baragwanath, we have repurposed beds. And we've also, during the first and second wave, we were able to create more than 400 beds to cater for people who might need care, who test positive for COVID-19. So we still have that capacity. It is not fully utilized. And there's also capacity in a number of other areas, George Mukari Hospital and the Bronco-Spruit Hospital. And we also, a few weeks ago, opened the Anglo Gold Ashanti Hospital. So there are a few hospitals where we have created additional capacity which did not exist before the end of last year. So we believe we will be able to cope with the increasing number of people who require hospital care.
And how many extra beds does that equal in total? Are you able to tell me?
When we did the count, we were just under 4,000 hospital beds, new capacity that was created.
And are those already ready? Are they already kitted out and completely ready should people need to move into them in the coming days?
They are ready. Some of them might need a minor adjustment and so on. And obviously the beds go with the staff. So at the same time, we're making sure that the Department of Health increases the staff capacity so that if the demand increases, we're able to care for all those people who require hospital care.
So we're not going to have a situation where people are being denied oxygen, turned away from any hospitals. And are you in a situation, because it looks like our private hospitals are taking more strain, where you're able to assist the private hospitals if necessary?
Yes, we work together with the private hospitals. We monitor the situation on a daily basis. So where we can take the load off the private hospitals, we are able to do so. We continue to collaborate with the private hospitals to make sure that we ease off the pressure.
All right. Well, thank you so much for chatting to us this evening. That was Thabo Masebe, Gauteng government spokesperson, telling us that there are about 2,500 COVID patients in hospitals, public and private, across the province this evening, though that number does fluctuate. But he says that they have 4,000 extra beds being set up and already set up at various hospitals around the province, including Chris Hani Baragwanath, and currently public hospitals are at 60 to 70% capacity, and that they can assist the private health facilities as well if they're under particular strain.